Hi everyone and welcome to my channel Hobeth BP. This video of mine is about insomnia. Well, it's a common sleep disorder that can make it hard to fall asleep, hard to stay asleep, or cause you to wake up too early and not be able to get back to sleep. You may still feel tired when you wake up. Insomnia can sap not only your energy level and mood but also your health, work performance, and quality of life. Well, before discussing insomnia in detail, let me tell you that I have recently launched my own website that is known as obethbb.com, and you can visit that website, and people who are fond of reading can take advantage of this because I frequently post topics about different medical illnesses, and if there is a trending topic I also post about that on this website. Anyway, coming back to this topic of insomnia, how much sleep is enough varies from person to person, but most adults need 7 to 8 hours a night. At some point, many adults experience short-term, acute insomnia, which lasts for days or weeks. It is usually the result of stress or a traumatic event. But some people have long-term, chronic insomnia that lasts for a month or more. Insomnia may be the primary problem, or it may be associated with other medical conditions or medications. You don't have to put up with sleepless nights. Simple changes in your daily habits can often help. Well, first of all, let me tell you the symptoms. Insomnia symptoms may include difficulty falling asleep at night, waking up during the night, waking up too early, not feeling well rested after a night's sleep, daytime tiredness or sleepiness, irritability, depression or anxiety, difficulty paying attention, focusing on tasks or remembering, increased errors or accidents, ongoing worries about sleep. If insomnia makes it hard for you to function during the day, see your doctor to identify the cause of your sleep problem and how it can be treated. If your doctor thinks you could have a sleep disorder, you might be referred to a sleep center for special testing. Now let me tell you the causes. Insomnia may be the primary problem, or it may be associated with other conditions. Chronic insomnia is usually a result of stress, life events, or habits that disrupt sleep. Treating the underlying cause can resolve the insomnia, but sometimes it can last for years. Common causes of chronic insomnia include stress. Concerns about work, school, health, finances, or family can keep your mind active at night, making it difficult to sleep. Stressful life events or trauma such as the death or illness of a loved one, divorce, or a job loss also may lead to insomnia. Travel or work schedule. Your circadian rhythms act as an internal clock guiding such things as your sleep-wake cycle, metabolism, and body temperature. Disrupting your body's circadian rhythms can lead to insomnia. Causes include jet lag from traveling across multiple time zones, working a late or early shift, or frequently changing shifts. Poor sleep habits. Poor sleep habits include an irregular bedtime schedule, naps, stimulating activities before bed, an uncomfortable sleep environment, and using your bed for work, eating, or watching TV. Computers, TVs, video games, smartphones, or other screens just before bed can interfere with your sleep cycle. Eating too much late in the evening. Having a light snack before bedtime is okay, but eating too much may cause you to feel physically uncomfortable while lying down. Many people also experience heartburn, that is a backflow of acid and food from the stomach into the esophagus after eating, which may keep you awake. Chronic insomnia may also be associated with medical conditions or the use of certain drugs. Treating the medical condition may help improve sleep, but the insomnia may persist after the medical condition improves. Additional common causes of insomnia include mental health disorder, and such as anxiety disorders or post-traumatic stress disorder may disrupt your sleep. Well, on this channel, Obeth PP, I have already posted videos about anxiety and post-traumatic stress disorder. And this is a very informative video, and you can see that video. Okay. Awakening too early can be a sign of depression. Insomnia often occurs with other mental health disorders as well. Medications. Many prescription drugs can interfere with sleep, such as certain antidepressants and medication for asthma or blood pressure. Many over-the-counter medications, such as some pain medication, allergy and cold medication, and weight loss products contain caffeine and other stimulants that can disrupt sleep. Medical conditions. Examples of conditions linked with insomnia include chronic pain, cancer, diabetes, heart disease, asthma, gastroesophageal reflux disease, GERD, overactive thyroid, Parkinson disease, and Alzheimer disease. Well, most of the disease which I have just mentioned, I have already uploaded very informative videos about these illnesses. You can watch those. Okay. Then another cause could be sleep-related disorders. Sleep apnea causes you to stop breathing periodically throughout the night, interrupting your sleep. Restless leg syndrome causes unpleasant sensation in your legs and an almost irresistible desire to move them, which may prevent you from falling asleep. Okay. Well, regarding restless leg syndrome, there is already a video which is very informative, and that video was uploaded some time back. You can see that video. Okay. Then other causes are caffeine, nicotine, and alcohol. Coffee, tea, cola, and other caffeinated drinks are stimulants. Drinking them in the late afternoon or evening can keep you from falling asleep at night. Nicotine in tobacco products is another stimulant that can interfere with sleep. Alcohol may help you fall asleep but prevents deeper stages of sleep and often causes awakening in the middle of the night. Insomnia and aging. Insomnia becomes more common with age. As you get older, you may experience changes in sleep patterns. Sleeping often and becomes less restful as you age, or so noise or other changes in your environment are more likely to wake up. Uh, with age, your internal clock often advances, so you get tired earlier in the evening and wake up earlier in the morning. But older people generally still need the same amount of sleep as younger people do. Changes in activity. You may be less physically or socially active. A lack of activity can interfere with a good night's sleep. Also, the less active you are, the more likely you may be to take a daily nap, which can interfere with sleep at night. Changes in health. Chronic pain from conditions such as arthritis or back problems, as well as depression or anxiety, can interfere with sleep. Issues that increase the need to urinate during the night, such as prostate or bladder problems, can disrupt sleep. Sleep apnea and restless leg syndrome become more common with age. More medications. Older people typically use more prescription drugs than younger people do, which increases the chances of insomnia associated with medications. Now I'll talk a little bit about insomnia in children and teens. Sleep problems may be a concern for children and teenagers as well. However, some children and teens simply have trouble getting to sleep or resist a regular bedtime because their internal clocks are more delayed. They want to go to bed later and sleep later in the morning. Risk factors. Nearly everyone has an occasional sleepless night, but your risk of insomnia is greater if you are a woman. Hormonal shifts during the menstrual cycle and in menopause may play a role. During menopause, night sweats and hot flashes often disrupt sleep. Insomnia is also common with pregnancy. If you are over age 60, because of changes in sleep patterns and health, insomnia increases with age. If you have a mental health disorder or physical health condition, many issues that impact your mental or physical health can disrupt sleep. If you are under a lot of stressful times and events can cause temporary insomnia, and major or long-lasting stress can lead to chronic insomnia. You don't have a regular schedule. For example, changing shifts at work or traveling can disrupt your sleep-wake cycle. So these were the risk factors. Now I'll discuss the complications. Sleep is as important to your health as a healthy diet and regular physical activity. Whatever your reason for sleep loss, insomnia can affect you both mentally and physically. People with insomnia report a lower quality of life compared with people who are sleeping well. Complications of insomnia may include lower performance on the job or at school, slowed reaction time while driving, and a higher risk of accidents. Mental health disorders such as depression and anxiety disorder or substance abuse. Increased risk and severity of long-term diseases or conditions such as high blood pressure and heart disease. Now I'll tell you some preventive measures. Good sleep habits can help prevent insomnia and promote sound sleep. Keep your bedtime and wake time consistent from day to day, including weekends. Stay active. Regular physical activity helps promote a good night's sleep. Check your medication to see if they may contribute to insomnia. Avoid or limit naps. Avoid or limit caffeine and alcohol, and don't use nicotine. Avoid large meals and beverages before bedtime. Make your bedroom comfortable for sleep and only use it for sex or sleep. Create a relaxing bedtime ritual such as taking a warm bath, reading, or listening to soft music. Well, on this channel with BB, I have a playlist of music therapy where you can listen to relaxing music. and that may be very helpful for your sleep. So you can watch the all my playlist, including this music therapy playlist. Okay. Now I'll come to the diagnosis of insomnia. I mean, when patients come to us, then depending upon your situation, the diagnosis of insomnia and the search for its cause may include physical exam. If the cause of insomnia is unknown, your doctor may do a physical exam to look for signs of medical problems that may be related to insomnia. Occasionally, a blood test may be done to check for thyroid problems or other conditions that may be associated with poor sleep. Sleep habits review. In addition to asking you sleep-related questions, your doctor may have you complete a questionnaire to determine your sleep-wake pattern and your level of daytime sleepiness. You may also be asked to keep a sleep diary for a couple of weeks. Sleep study. If the cause of your insomnia is not clear or you have signs of another sleep disorder such as sleep apnea or restless leg syndrome, you may need to spend a night at a sleep center. Tests are done to monitor and record a variety of body activities while you sleep, including brain waves, breathing, heartbeat, eye movements, and body movements. And now let me tell you the treatment. Changing your sleep habits and addressing any issues that may be associated with insomnia, such as stress, medical conditions, or medications, can restore restful sleep for many people. If these measures don't work, your doctor may recommend cognitive behavioral therapy. CBT medications are both to help improve relaxation and sleep. Now I'll throw some light on cognitive behavioral therapy for insomnia. Well, CBT for insomnia, as we call it CBT-I, can help you control or eliminate negative thoughts and actions that keep you awake, and is generally recommended as the first line of treatment for people with insomnia. Typically, CBT-I is equally or more effective than sleep medications. The cognitive part of CBT-I teaches you to recognize and change beliefs that affect your ability to sleep. It can help you control or eliminate negative thoughts and worries that keep you awake. It may also involve eliminating the cycle that can develop where you worry so much about getting to sleep that you can't fall asleep. The behavioral part of CBT helps you develop good sleep habits and avoid behavior that keep you from sleeping well. Strategies include, for example, stimulus control therapy. This method helps remove factors that conditions your mind to resist sleep. For example, you might be coached to set a consistent bedtime and wake time and avoid naps. Use the bed only for sleep and sex, and leave the bedroom if you can't go to sleep within 20 minutes, only returning when you are sleepy. Relaxation techniques. Progressive muscle relaxation, biofeedback, and breathing exercises are ways to reduce anxiety at bedtime. Practicing these techniques can help you control your breathing, heart rate, muscle tension, and mood so that you can relax. Sleep restriction. This therapy decreases the time you spend in bed and avoids daytime naps, causing partial sleep deprivation, which makes you more tired the next night. Once your sleep has improved, your time in bed is gradually increased. Remaining passively awake, also called paradoxical intention. This therapy for learned insomnia is aimed at reducing the worry and anxiety about being able to get to sleep by getting in bed and trying to stay awake rather than expecting to fall asleep. Light therapy. If you feel asleep too early and then awaken too early, you can use the light to push back your internal clock. You can go outside during times of the year when it is light outside in the evening, or you can use a light box. Talk to your doctor about recommendations. Your doctor may recommend other strategies related to your lifestyle and sleep environment to help you develop habits that promote sound sleep and daytime alertness. Now I'll tell you about some prescription medications. Well, prescription sleeping pills can help you get to sleep, stay asleep, or both. Doctors generally do not recommend relying on prescription sleeping pills for more than a few weeks, but several medications are approved for long-term use. These examples include Esopicolone, that comes with the name of Lunesta. And then another medicine is Remiltion, that comes with the name of Rosirem. Zaliphlon, that comes with the name of Sonata, and Zolpidem, that comes with the name of Ambien. Okay, so these prescription pills can have side effects such as causing daytime grogginess and increasing the risk of falling, or they can be habit forming. So talk to your doctor about these medication and other possible side effects. Then there are some over-the-counter sleep aids. Non-prescription sleep medication contain antihistamine that can make you dozy, but they are not intended for regular use. You should talk to your doctor before you take these, as antihistamines may cause side effects such as daytime sleepiness, dizziness, confusion, cognitive decline, and difficulty urinating, which may be worse in older adults. Now I'll throw some light on lifestyle and home remedies. Well, no matter what your age, insomnia usually is treatable. The key often lies in changing your changes to your routine during the day and when you go to bed. Now I'll tell you some tips. Well, basic tips are: stick to a sleep schedule, keep your bedtime and wake time consistent from day to day, including on weekends. Stay active. Regular activity helps promote a good night's sleep. Schedule exercise at least a few hours before bedtime and avoid stimulating activities before bedtime. Check your medication. If you take medication regularly, you should check your doctor to see if they may be contributing to your insomnia. Also, check the labels of OTC product to see if they contain caffeine or other stimulants such as pseudoephedrine. Avoid or limit naps. Naps can make it harder to fall asleep at night. If you can't get by without one, try to limit a nap to no more than 30 minutes and don't nap after 3 p.m. Avoid or limit caffeine and alcohol and don't use nicotine. All of these can make it harder to sleep and effects can last for several hours. Don't put up with pain. If a painful condition bothers you, talk to your doctor about options for pain relievers that are effective enough to control pain while you are sleeping. Avoid large meals and beverages before bed. A light snack is fine and may help avoid heartburn. Drink less liquid before bedtime so that you won't have to urinate as often. At bedtime, make your bedroom comfortable for sleep. Only use your bedroom for sex or sleep. Keep it dark and quiet at a comfortable temperature. Hide all clocks in your bedroom, including your wristwatch and cell phone, so you don't worry about what time it is. Find ways to relax. Try to put your worries and planning aside when you get into bed. A warm bath or a massage before bedtime can help prepare you for sleep. Uh, Create a relaxing bedtime ritual such as taking a hot bath, reading soft music, breathing exercises, yoga, or prayer. Avoid trying too hard to sleep. The harder you try, the more awake you will become. Read in another room until you become very drowsy, then go to bed to sleep. Don't go to bed too early before you are sleepy. Get out of bed when you are not sleeping. Sleep as much as you need to feel rested and then get out of bed. Don't stay in bed if you are not sleeping. Now I'll throw some light on alternative medicine. Well, many people never visit their doctor for insomnia and try to cope with sleeplessness on their own. Although in many cases safety and effectiveness have not been proved, some people try these therapies which I am going to tell you, such as melatonin. This over-the-counter supplement is marketed as a way to help overcome insomnia. It is generally considered safe to use melatonin for a few weeks, but no convincing evidence exists to prove that. Melatonin is an effective treatment for insomnia and the long-term safety is unknown. Valerian. This dietary supplement is sold as a sleep aid because it has a mild sedating effect, although it has not been well studied. Discuss valerian with your doctor before trying it. Some people who have used high doses or used it long term may have had liver damage, although it is not clear if valerian caused the damage. Acupuncture. There is some evidence that acupuncture may be beneficial for people with insomnia, but more research is needed. If you choose to try acupuncture along with your conventional treatment, ask your doctor how to find a qualified practitioner. Yoga or Tai Chi. Some studies suggest that the regular practice of yoga or Tai Chi can help improve sleep quality. Meditation. Several small studies suggest that meditation along with the conventional treatment may help improve sleep and reduce stress. Now I'll tell you some caution regarding herbal and dietary sleep aids. Because the Food and Drug Administration does not mandate that manufacturers show proof of effectiveness or safety before marketing dietary supplements, sleep aids. Talk with your doctor before taking any herbal supplements or other OTC products. Some products can be harmful and some can cause harm if you are taking certain medications. Okay. So generally, I will not recommend these kind of this herbal medicine. Okay, until you see a qualified doctor like me and you discuss your medicine before taking these supplements. Okay. So this was my video about insomnia. I hope you like this video. If you have any question about insomnia, you can post in the comment section. On this channel, the BB, there are so many videos about different health issues, and you can watch all those videos. And if you or your loved one is suffering from any illness for which video is already not there, you can post in the comment, and as soon as I find a time, I'll try to upload a video about that particular illness. Thanks for watching this video. See you in next video. Bye for now.